Hi, now let's get some understanding about the role of therapists. A narrative therapist works with clients to explore the stories that they carry about themselves, their life, and their relationships. When a dominant story is problematic, it will surface in our interactions with others, in our decision making, and in our behavior patterns. The therapist's role in narrative therapy is to regard the client's stories as a life full with undiscovered possibilities. A significant aspect of the therapist's role is to direct the conversation. He or she will ask the client what they want to discuss to get the conversation started. The questioning and conversational stage usually reveals the presenting problem, and the client is encouraged to continue their story. Therapists help clients to see their problems as separate. To more easily understand them, therapists use metaphors based on what they have learned from talking with the client. If the client is a mechanic, a therapist might use a metaphor based on rebuilding an engine to help the client see the problem from a different perspective and view it as something which the client can control. Part of externalizing the problem is finding times in a client's life when the problem was successfully pushed aside or not allowed to exert as much influence. When these exceptions are found, they are explored in as much details as possible. This allows a person to be able to see that they do have a power over the problem. When a person sees that they have a power over the problem, they can begin to re-story their life in a more positive way, knowing that they can keep the problem from having its own all influence over them. Finally, the therapist help the client to consolidate this new positive story, assuring them that they have what it takes to live life in a new and empowered way. If you think that your story might need some re-authoring because there is a problem that has too much influence in your life, narrative therapy may be a way for you to write your story the way you would really like it to read. There are several unique aspects of the narrative therapy. Families learn to value their life experience and stories and re-author their life. Families learn to find exceptions to their regular patterns of living. Problems are externalized and work on cooperatively. Expectations and setbacks and the raising of dilemmas help to lower resistance. Letters to families by their therapists are sent regarding their progress. Celebrations by families and therapists are held when goals are reached. The final part of this online lecture will focus on the comparison with other theories. Although the narrative therapy appears appealing and innovative at a certain level, some issues need careful review. Postmodern therapies could serve as a third wave of therapeutic approaches that aim to modernize many aspects of psychotherapy. However, proving the efficacy of any form of treatment takes much time and research. Narrative therapy is relatively new in comparison to traditional therapeutic methods. There is a shortage of scientific research supporting the overall effectiveness of this approach. Additionally, certain types of clients would not qualify as good candidates for narrative approaches. In particular, clients with psychotic issues or who have limited intellectual, language, or cognitive skills may not be suitable for this approach. However, narrative therapy has also showing potential for the treatment of numerous scenarios. Although the approach is lacking much on empirical study data, there is enough research to assert that certain individuals, couples, and families has gained benefit from the processes involved in the narrative therapy process.